The Solent NHS Trust have launched a HIV live chat. The service supports people living with or those who are affected by the virus. And joining me now is Debbie Zimmerman to explain further. Well, thank you for coming in, Debbie. And we were talking a little bit there that it doesn't seem to be the big social stigma anymore, maybe that it was in the 80s, having the condition or the virus, as we used to say.
Absolutely. I think that, today living with HIV is very much that term is living with it. And I think if people come to our service and seek the right help, get the support with their medication, then they can live very healthy, happy lives.
That's it. And that's it. It doesn't have to be the death sentence anymore that maybe the adverts with John Hurt and the tombstone people might remember. Obviously, there is help out there, and this new service is a way of offering that help in a different package.
Absolutely. I think, we're in a completely different era now, and, the medication and the support that you can get from our services is second to none.
And we were talking a little bit that maybe some people are still a little bit embarrassed about their sexual health, and actually this gives them a new doorway into it, discussing it in a safe environment. Absolutely.
I think that, there are certain cultures and beliefs that people still hold about sexually transmitted infection. And so really the offer of the web chat online is a way that people can, link into the service in a secure, confidential way, and that they can, have a secure chat online with the healthcare professionals and help them, learn all about their condition.
Excellent. And that's the thing, obviously, the generation maybe that you're pointing at will be already versed with using web chat to find out about their phone bill, or web chat to find out about their banking and things like that. Absolutely. So you're trying to tap into that generation and give them that extra option.
Yes, I think it's all about ensuring that people that have access to sexual health care have a variety of options to link into the service. And, the web chat is another way, if you like, and that can also link in. We can signpost people to sexual health online testing, so they can have full health screening online. We can also offer them appointments, so and also we can link into other services such as health promotion and also other partners. So we have links with Positive Action and Peer 100 to be able to give them as much support as they possibly could hope to have.
That's it. And it's that word support as well. I know for a lot of people, maybe the idea of getting screened for anything related to sexual health sometimes is either embarrassing, or that there's the fear that it's going to be quite intrusive. And this is just kind of a softer way into that, maybe.
Absolutely. And I think that, people can just generally chat about the things that concern them and worry them in an environment that is very safe, and they can generally ask as many questions as they like and take as long as they like, and talk to professionals that will be able to guide them and help them through their condition and illness.
I think what I quite like about this idea as well is that with the form of a web chat, you can keep a transcript of your discussion with the professional, whereas if you just talk to somebody like we are now verbally, you don't always have a record of what you've gone through, and so afterwards you'll have it playing in your mind. What did they say? At least here now you can go back over the conversation and kind of reassure yourself again, really.
Absolutely. But the other thing to reassure people is that within our service, unless people actually give us permission to keep that information, we delete that information straight away. So again, it's not going to be sitting on any files or any records. It's really for us to be able to help the individual when they contact us.
So it's as private, if not more so private, than going to see your GP?
Absolutely, yeah.
And what's the uptake been on the service so far? What have you seen?
So it's very new, and we literally haven't advertised at all. So this is the start of that journey. And, we've had about 30 contacts already. Asking various different questions, asking about their results, asking about conditions, medication, also seeking other information about sexual health generally. So I think that there's a long way to go, but we're learning all the time, and so far we've only got it available from 12 till 2, but what we've learned already is that a lot of people prefer it to be available later on in the day, and so we're reviewing that as we go along and evaluating it, and then we can extend the service as we move on.
Okay, and I suppose one important thing to say is it's not just for younger people that may be a bit more
No,
tech savvy.
absolutely not.
It is for absolutely anybody to use, any age, any gender, any sexual preference.
Absolutely right. And the thing is that if people were to access our website, then if you're not happy with going online to pursue things, if you like, through the sexual health route, there are also telephone numbers available where people can have a conversation with us via the telephone if that's an easier way for them.
Fantastic. Well, the service sounds like it's going to be a fantastic tool for people to use, and obviously we want to let people know how to get there. So where do we go if we need to find it?
Okay, so our website is the Let's Talk About It website, and you literally, if you just go into the browser and type that in, then depending on the area that you live in, it will signpost you to the Let's Talk About It website in either Southampton, Hampshire or Portsmouth.
Brilliant. Well, Debbie, thank you very much for coming in and talking to us about this today. Thank you.